Okay, we're with Tom Mulvey from Athletic Sports and Physical Therapy. Tom, thanks for coming on board, buddy.
Thanks for having me.
All right, this segment we're going to talk about shoulder pain in the throwing athlete. And what structure make up the shoulder complex?
Shoulder complex is made up of a shoulder blade, which is posterior, the clavicle, which is in the anterior, and the humerus bone, which occurs, obviously, connecting the arm to the shoulder blade. We also have the rotator cuff, which we see in the back here, on top and in the front. And we have then these whitish tissues, which are a combination of the tendons of the rotator cuff and the glenohumeral ligaments, which make up the joint capsule.
Okay. You know, when a throwing athlete, a pitcher, complains about, some pain, what do they typically complain of?
It can be a series of things, Pat. It can be a dull aching pain that will occur within the joint, maybe later in the evening or the next day. They'll complain of some sharp pain that may occur in the anterior, slightly lateral area of the shoulder. They'll complain of some pain, which is in the superior portion of the shoulder. They'll complain of some sharp pain, perhaps in the posterior area of the shoulder. They'll complain of having weakness, the arm kind of feeling tired, and the arm feeling kind of stiff.
Yep.
And all of those things are part of a process that starts to occur within the joint.
Okay, and so what happens to the shoulder of a throwing athlete?
A series of things, Pat. One is that the position of this shoulder blade to clavicle to humeral position is critical, and the muscles that are around it are vital. The rotator cuff muscles are what's called dynamic stabilizers. They help to keep the humerus bone connecting to the structure of the scapula itself. There's a labrum inside that you'll hear a lot of people talk about. That labrum is an attempt by the tissue to take the connection of these ligament tissues to give more surface area to this humeral bone and to give a better stability in the joint. The ligaments are a passive stabilizer. They are providing stabilization to occur there, and in combination with everything else, trying to make a very, very mobile joint very stable. The problem is, weakness occurs that changes the position of the shoulder blade, changes the position of the humeral head, and results in a less efficient system working.
Yep. So what should parents be concerned about?
They should be concerned with a lot of things. With more and more throwers, even though they're counting innings, let's say, in their weekly competition, these are the same kids that are going to pitching coaches. Those pitches are not being counted. Practice is occurring. That's not being counted. And what happens is that when this system is not efficient, there's a impingement occurring of this soft tissue that starts a process of wearing down of that tissue. Inflammation, swelling, pain. The tissue is being worn down over a series of years that can have a detrimental effect.
Okay. All right, Tom. Very informative. Thank you very much.
Thanks, Pat. Thanks for having me.